Welcome to Introduction to Hysteroscopy. Part 2, Navigation with the Hysteroscope. Available viewing angles for the hysteroscopes include 0, 12, 25, 30, and 70 degrees. A 0-degree hysteroscope provides a panoramic view in line with the sheath. Increasing viewing angles allow the surgeon to visualize areas to the left or right of midline without needing to shift the telescope from side to side, for example, to view the tubal ostia or a focal lesion in an irregularly shaped cavity. When using an angled hysteroscope, the light cord controls the angle of view. However, the light cord position does not change your angle of view when using a 0-degree lens. The tubal ostia may be visualized with minimal angulation of the hysteroscope and is accomplished by merely rotating the scope in the appropriate direction. With the light cord down, the lens will be up and your view will be looking up. With the light cord up, the lens will be down and your view will be looking down. Because you're using an angled lens, the cervical canal should not be in the middle of your screen. This would mean that you are burrowing through the posterior wall of the cervix and likely traumatizing the cervix, and you can make a false passage. Start with entry into the cervix. With the light cord down, you'll be looking 30 degrees up, so your view going through the cylinder should be with the focal point of your anatomy, which is the cervical canal at the bottom of your screen. Once through the cervix, obtain a global view of the uterine cavity. Here, you should see 5 to 6 of the letters and symbols located on the anterior, posterior, right, and left walls of the uterus. Your goal for this portion of the task is to correctly orient the light cord and navigate the camera in order to place each letter or symbol into the middle of your view with correct orientation and focus to occupy at least 50% of your view. With the light cord up, you'll be able to look down at the posterior wall of the cavity. The Q represents the posterior wall of the cavity at the level of the corpus. The spade represents the posterior wall at the fundus. The club is located straight ahead, symbolizing the fundus. Swing the light cord to the left to see the J, which represents your patient's right tubal ostium. And swing it into the opposite direction to focus on the A, which represents the patient's left tubal ostium. Now move the light cord to face down in order to look up and focus on the K, representing the anterior wall of the fundus. Back the hysteroscope out and get another global view and remove the scope. Remember, smooth, non-jerky movements will minimize trauma to your patient, decrease pain, and decrease the risk of uterine perforation.